Dear viewers, welcome you all to our show, Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today our topic is the deformity correction by Elizarov, especially upper limb. We all know that the deformity is a very challenging thing for all orthopedic surgeons. We can easily correct it by Elizarov, but how? And that will be discussed today by the magnificent presenter, the one and only, the legendary Elizarov surgeon of Bangladesh, Professor Mofakharul Barisar. I would like to request Professor Mofakharul Barisar to join with us.
Good afternoon. Thank you, Tanvir.
Thank you very much, sir. Dear viewers, we have two learned academic panel. One is the highly academic Professor Novikov sir from Kurgan, Russia. Professor Novikov sir, would you please join with us? Welcome, sir. We can't hear you. You have to unmute yourself. Okay, dear viewers, we have another academic panel. That is Dr. Shamsul Huda from Patna, India, and he will be with us in the coming part of our program. Dear viewers, now I would like to request our honorable speaker, Professor Mofakharul Barisar, to start his presentation. Sir, would you please share your screen with us?
Okay. Can you see my screen now?
Yes, sir.
This
We
one?
can.
Okay.
Yeah.
Dear friends and my dear colleagues and viewers, today I'd like to talk on the Ilizarov upper limb reconstruction. In the last lecture, previous Friday, I talked on the wrist, and today I will talk on the deformity correction of the upper limb. Here is the humerus, radius and ulna, wrist and the metacarpal bones. In one lecture, it is very difficult to cover all these things. So these are my training. This is the Ilizarov Center, world-renowned orthopedic capital. This is our institute, and this is my working place at present. And this is my personal center. These are the Professor Ilizarov. I would love to show this one 4M. And now you can see here, upper limb reconstruction in different diseases is a good choice of treatment. These are the pictures when I was in Kurgan. They have a lab, very big lab, where you can see the lot of cases that is in the model bone, starting from the head to the toes, how to correct, how to place the wires. These are the models from the Kurgan Center. So now, dear friends, you can see varieties of the deformities in the upper limb. You can see in the top four and the top five and the below five, all the deformities are different, and these most of the cases you can see the children and in adult also. So now, if you look at this is called AD. The Elizarov, it can do wonders. Deformed, dysvascular, dysplastic, destroyed, dislocated, derotation, deficient, and discrepancy. So I have made this one so that you can easily understand what you can do by Elizarov technique. And our aim is to aesthetically beautiful functional arm, forearm, and hand, and to correct the shortening and the deformities. Biological reconstruction is the cornerstone, and our aim is to normalize the anatomical axis. Now, regarding the diseases concerned, what we can do, if we talk about the deformity of, you can see GCT with problems, lot of problems, the head of the humerus and the radius, even in the humerus. Old fracture dislocation of the elbow, neglected cases, lengthening of the arm and the forearm, FFD of the elbow and pterygium of the elbow, and different varieties of non-unions with angulation, translation, and other things in the radius and ulna. And if you think about the upper limb, you'll see humerus angulation, cubitus varus and valgus, big gap non-union of the radius, and serpentine deformities of the forearm bone. Now, why Ilizarov? See, This Elizarov compression distraction divide provides flexibility and adaptability. And very important thing is that the Elizarov serves four purposes. And number one, it gives mechanical stability. While you are giving mechanical stability, and at the same time, when you apply compression or distraction, you are getting billions of cells around the light of compression or distraction, and you are increasing circulation 330%. Professor Ilizarov showed that in 1983. And you are not disturbing anything. All things will be preserved by Ilizarov technique. And if you talk about the advantage of Ilizarov, this is modular, this is customizable, can treat multi-level, multi-plan, and multi-directional deformities. Even you can articulate across the joints. So disadvantage only is the greater learning curve. That is limitless. Starting from day one, you have started till your death, till your death, you should have to learn this Elizarov. No limitation of Elizarov technique. And regarding the post-operative care is very important. That is the main key to success. Now, what is the position of the patient? If you think about the upper limb, you see there's a special device for application of Ilizarov. If you want to put Ilizarov in the humerus, there is arm or radius annular wrist. If you put your patient in this device, it will be very easy for you to put the wires. Now, again, these are very important. Without basic things of knowing the Elizarov, you cannot proceed for the difficult cases. Look at this here, dear friends. Position of the wire, you can see when you are putting wires from the top, you will go like this, and you're putting, hitting the bone, and then you're piercing the bone. And this one you see again direction of the wires. This is your non-union or fracture or anyone or deformity. You should have to keep your hands like this from this situation to this situation. And when you are putting this, look at this, how you'll place your hand and wrist. And when you are already past the cross of wires, the angles between them is 35 to 60, 65. Sometimes, depending on the anatomy of the case, you can put the 10 to 90 degree of angulation. But everywhere 90 degree, this is not possible. Now you can see the face of the hand. This is the face, and you can place your wires in this situation. This is anatomy you should have to know. This is also anatomy, neurovascular structures. When you keep it in your mind, the structures and the muscles and the nerves. Always you should have to think yourself, where is the brachial plexus? Where is the muscles? Where is the veins, cephalic vein, and other musculocutaneous nerves, axillary nerves, and anatomy, anterior circumflex, humeral artery, posterior circumflex, humeral artery. These are the important neurovascular bundles. You should have to keep it in your mind when you apply the Elizarov apparatus. And regarding the radius and ulna, again, dear friends, the most important three nerves are median nerve, ulnar nerve, and ulnar artery. It is very easy to remember. You can see here the radial artery, superficial radial nerve, posterior interosseous nerve, and at the same time brachial artery and the radial nerve. Very easy to recapitulate in your mind when you will put the Elizarov wire. Neurovascular structure, again you can see ulnar nerve, median nerve, ulnar artery, and here you can see here radial nerve, posterior interosseous nerve, superficial nerve, radial nerve, and the radial artery. Now, if you find three kinds of wires, stoppers, this is easily available. If you don't have this kind of olive, you can make like this with simple smooth wire, cork like. This is a cork screw like, and or you can make like jet like, bayonet like. You can make easily with simple smooth wire. If it is this type, this is very good. You can get force with this type of olive wires. Now, this is a diagram just to keep it in your mind for wire insertion in the forearm zone. Here we have separated this into 7 zones. We have classified or grouped into 7 zones. Look at the level of the proximal metaphysis, level of the upper third, level of the middle third, and the level of the lower third of the forearm, and at the same time level of the wrist and at the level of the hand metacarpals. Now, corticotomy is also important. Pre-operative planning is very, very important in every case. In case of Ilizarov, while you are doing deformity correction, you are correcting shortening, or you are doing any kind of joint stiffness. All the patients are explained about the problem. You must do that at the treatment procedure. At the same time, post-operative protocol is very important when patient will be in your hospital, or when you will discharge the patient, you must instruct the patient regarding this technique and how to handle the apparatus. And post-operative management for every patient, we always suggest go for exercises. We encourage the patient if pain-free, pain permitted. And cleaning of the wires, wire side regular interval, discharge with follow-up every week until radiological sign of union we can see. Apparatus removed, you can remove the apparatus in outdoor or in indoor basis. So now this is just one a video clip. You can see how we are putting the wires in the hand. A small kit, you can see, very easy to put the wires in the fingers and in the wrist also. You can see here, this is the deformity correction of the forearm bones. Initially, when you'll see, it will be difficult for you to understand, but to passing the wires, it is not so difficult. See, olive wires is passing through the all the metacarpal bones. This one you can see in the video. So, uh, how to put the wires, and if dynamometer, you can apply the tensioner and striving force around the ring must be equal. And see, so this is I am doing my center with my the right side Natalia Shikilova in Dhaka, and other colleagues, and this is the deformity correction of the forearm and the wrist. So just have a look how you can put the 1.5, or even in children 1.
Sir, we can't see your screen now, sir. Professor Mafakrul Bari, sir, can you hear me, sir? I think there is a network problem there, and I hope Bari sir will join with us with a few seconds.
I think he has some network error.
Yeah, definitely. During playing the video, he is facing this problem.
In the meantime, Noviko sir can put his view.
Navikov sir, can you hear me, sir? Navikov sir, can you hear me, sir?
Yeah, why not, please?
Sir, as Bari sir is disconnected with us, he will join with us within a few minutes. During this time, we want to gather some knowledge from you, sir, regarding the deformity correction.
And in our experience, for example, just now in our department, 35 beds, 35 patients, and one, two, three, five patients with problem upper part. All of these patients after trauma and congenital disease. And this is biggest part in from our patients. Difficult area for surgeon, but impossible get result without good knowledge about treatment in this area. And for young doctor who want to start treat a patient with, for example, short or deformity, doesn't matter. This is humerus or wrist. Better with doctor with big experience. When we recommend our technique, our methods, Elizarov methods, usually we recommend start from tibia, then femur, then humerus, and last segment for treatment for surgery. This is forearm. And without knowledge, without workshop, without webinar like now, I think better not touch for Elizarov technique. But this is excellent and very effective technique. If a doctor will start, why? Because during the treatment, we can go away, anytime I talk about that, we can go away from every difficulties, from any deformity, and we can finish treatment with perfect, excellent result. Dear colleagues, do you heard me?
Yes, sir, I can hear you, sir.
And for example, in your clinic, doctor, how many patients from all of with problem with upper part, with upper extremities? I think in our experience, more than 20-25%. I talk about orthopedic case, not trauma case.
Sir, have you faced any challenges
Dr.
during
Shamsu,
the...
Yes, sir. Yes, sir. So normally we are getting more cases of post-traumatic deformity or post-infective deformity in upper limb and lower limb both. Sometimes we get pseudoarthrosis also. Most of the times it is post-traumatic or post-infective cases of deformity in the upper limb. So in these cases, I usually go for Elizarov deformity correction. I have a question from you, sir, again, sir. Like when you get a hard sclerosed pseudoarthrosis in the humerus, very hard bone, do you just try compression, distraction, or you also apply graft or long rejection in these cases by disclose the pseudoarthrosis or non-union of the humerus? No, because sir. Sir, we cannot hear, sir.
Uh,
Yes, sir.
yeah, just now we prefer only open surgery. Before we can get result with closed methodic, but now open and very seldom, very seldom we use bone graft. And just now better first compression, then start lengthening. Sometimes for young patient, only sometimes, we can talk about bifocal, one place compression, another place distraction. But when we think about guarantee, when we think about result during short period, better if we will finish with one technique, compression, and then maybe without remove of frame, but I prefer finished this page. After rest of from first stage, after a few months, we can start treatment for equalizing, for lengthening. And I am happy because very seldom our patient has defect, pseudoarthrosis. Usually our patient has normal regeneration, but after plate, after nailing, 2-3 patients in a year, no more. Because no, for me, enough my patients. And after Elizarov technique, I never have pseudoarthrosis in the humerus. In the wrist, sometimes old patients like 38, old patient, we have some problem with regeneration. We have maybe 2-3 patients from 10 with pseudoarthrosis. But generally, when patients come previously for our treatment for correction deformity or lengthening, after Ilizarov technique, we haven't pseudoarthrosis.
So in these
Dr.
cases, for just one last question, when you had less process, sir, you do say that you do compression and then do gradual distraction. How many days before distraction you put for compression?
This is depend of case, and just now our politic not to do long period doesn't matter, distraction or compression. During the minimum 2-3 weeks, we need get result, then fixation. Because, doctor, this is my experience. Maybe I haven't knowledge enough, but if our patient with a frame more than 5-6 months, problem, and after problem will come complications. Now, before treatment, before surgery, I am agree with great surgeon Dr. Barry. I am follow his politic before pre-operative planning. We planning for short period of treatment. And just now, patient has so many problems, big shortening, big deformity. But my plan for short period of treatment. Then better twice surgery with short period of treatment.
Tanvir,
Thank you, sir. Yes, sir.
so
Thank
I'll
you. Thank you very
continue.
much, sir. Yes, sir. Please continue, sir. Please share your
Barry,
screen. We are
please
waiting for you,
continue.
sir.
Okay, thank you. So what happened, I don't know. You should not. I'm proceeding further. This is, now you can see.
It's coming, sir. Yeah, we can see now.
Yes, sir, you can see.
See, this is the case. If you don't see, you just remind me. Okay?
Yes, sir.
Now you can see the post-septic, how much shortening. Now see, do the exercises. Now you can see. At the same time, she is moving fingers, elbow, and shoulder. And how much lengthening I have done, you can see after 10 months the result. 11 months follow-up before and after, just like you can compare from left side to right side, here to here. This is also published in MedCrave last year, August. Now, dear friends, you can see the cubitus valgus, flexion position before surgery. Now, this is the drawing, how you can put the wire and how you can put the ring. Very simple. And this is the opening wedge. You can correct. You don't need to do any difficult case. You see, from this situation, from this situation, one ring, and this is the, you can put here full ring, you can put here full ring, and do a osteotomy here, and you can easily correct. So this is the case that I am showing you. Follow-up after 2 months. This is after 4 months follow-up. You can compare from this situation to this situation, and this situation, that situation. There is a difference. You just remember, you just see. This is also published. Whenever I do anything, any difficult case, I put publication so that people can read and understand. And these are the documents. You can see at the same time, you can go for open surgery also. You go for 2 times surgery, including the pads, being a scar, nothing else. See, you can see here the deformity, osteotomy, just I showed you in the picture. And then now you can see the full correction. This is also published in 2015, medial weight osteotomy by Elizarov technique. This is the pterygium. You see here the soft tissue, combination of soft tissue and Elizarov hinges. Release, and this is after 4 months follow-up. See, neglected old case, 27 years, young chap. This very easily you can correct this kind of deformity by opening the small incision and then put your Ilizarov one and ring above, one ring below, and do the exercises. Tell your patient go for exercises. And you can see from here, you can see these are the cases. These are the cases, and then see after how many days this situation with Ilizarov, from this situation to that situation. Now you see the serpentine deformity of the radius and ulna, see the elbow, see the near wrist. This is the situation with deformity, this kind of 14 years old boy. And at the same time, post-op 4 months, post-op you can see, and this is 6 months follow-up from this situation to that situation, fully corrected. Patient is happy. Now, I would like to share my very bitter experience with this. I took it as a challenge. I could do another operation, but sequentially, I treated this patient, see the osteomyelitis. You'll get lot of cases in our subcontinent. Here you can see no bones, no bones. Then he came to I started treating when he came at the age of 9. Now see, I have lengthened this part, and this is after 7 months follow-up. 7 months follow-up. Atrophic bone here, and then same patient, second step surgery, and I've done the third step surgery. Now you can see, dear friends, from this situation to that situation, he is happy. This is united. This is united. Lengthening from this situation, wrist was deformed, and patient is happy. Now, hand can reach up to the mouth. So, another case, see, very difficult deformity, only radius, no ulna. Migration of the radial head, 17 years old girl. Then Critical photograph you can see here. Again, I have corrected this one with Ilizarov apparatus. And then you can see here, this is the situation. This is the proximal radius and clinical appearance of the patient. No bony bump is here. And this is also a very bad case. 6 years old atrophic non-union, both radius and ulna, with deformity, shortening of the, atrophic of the bone, and muscles was very much atrophy and tightened muscles. And then initially I applied 2 rings to just for lengthening of the vessels and muscles of the nerves. And then I have changed the situation, and then gradually I have corrected this one. And this is, you can see, from this situation to this situation. Now, beautiful girl, and how you can manage this kind of deformities with Ilizarov technique. This is a good consideration. You can see here, this is only after 9 months. This is published in Kurgan. You can see here. This is another one, another American journal, Juniper. Now, these are the cases. You can see, dear friends, post-infective left forearm and wrist deformity and ulnar deviation. You can see here at the age of 4. And she came to my place with this situation. Just compare right with the left. Beautiful girl. Face is very beautiful. Then what to do? Then came to my place. I took it as a challenge, and I have gradually corrected. You can see here, did the osteotomy here, and then you can look just what I have done here. 1 ring, 1 ring, 1 ring, 1/2. And then gradually I have corrected. Now you can see from this situation to this situation, almost corrected. Now you can compare the left hand and the wrist, and this is the left hand and the wrist. So patient is happy. This is a again post-osteomyelitic. You can see one case before, how I treated that one and what I have treated that one. You can see the difference between that. Here ulnar bowing with shortening 7 centimeter, resolved right radius, and distal radioulnar joint instability. You can see, dear friends, I did the osteotomy to correct the deformity where is the bony bump, and then I have opened it up a little bit and denuded that one. And this is the situation of the hand. You can see from this situation to that situation. And this is the video. You can see here how she was moving before that and just after removal of the apparatus. Look the external view of the hand and the wrist, fully corrected. And this is the beauty of Elizarov. This is the magic of Elizarov. So you can do, these are the difficult case. Medical student, you can see diaphyseal eclasis. Diaphyseal eclasis. When he was 3rd year, he was referred to one of our orthopedic surgeon, came to my place. I did the, osteotomy and lengthening with vector. Did the olive from this side, that side, put 1 ring here, 1 ring here, 1 ring here. Then gradually I have done the osteotomy, deformity and lengthening, deformity correction and lengthening. And finally, dear friends, you can see from this situation, pronation and supination was not too much. That was restricted. Now you can see here, left side and right side. This is also beautifully corrected by Ilizarov technique. Also, this is published in 2018 in American Journal. This is the case of Volkmann's ischemic contracture of the wrist. So far I have seen no other good technique except Ilizarov. See the skin, scar of the tissues. If you go for, again, this is applicable for Ilizarov law of tension and stress. This is very important, Elizarov's law. Slow and steady traction on a living tissue creates a stress which is metabolically activated and which stimulates histoneogenesis, dermatogenesis, neurogenesis, angiogenesis, and osteogenesis. During treatment, smiling patient, now you can see how we have corrected this. And the skin condition, the beautiful skin condition is here and fully corrected from this situation to that situation. Just look at the wrist, look at the fingers. So another case, VIC, dear friends, you can see deformity of the wrist, and you can see the muscle atrophy. Distal radioulnar joint here and proximal also here. Now, what we have done, you can see fixed with Ilizarov after 2 months follow-up, after 5 months follow-up, this is after 7 months follow-up, and then now you can compare the left side of the hand, left hand here from here after treatment. It took, of course, lot of problems in the fingers and the wrist, 11 months follow-up. Now, this is the case came to me from Saudi Arabia. Look at this young chap, 25 years old, flexion contracture of the all proximal and distal interphalangeal joints. This is the moment that you have seen. What I have done, see, put 2 rings here, and these are the multiple 1.5 K wires are post. I have distracted from thumb to this one, and then gradual distraction. What happened? Only after 3 months tissue genesis, and you can see how he's moving his hands from that situation to this situation. This is during treatment, and everything is lengthened. See here how beautifully he is moving the hand. If you go for open surgery, you will make additions. So these situations to that situation after 3 months follow-up. So this is a case, one thing, 12 years old male, you can see, dear friend, syndactyly here, syndactyly, bone condition. What you can do, you can go for, see the radiograph, put your 1 bar here, 1 bar here, put the wires and go for distraction. This is widening of the bone, skin, and then see after treatment, you just divide that one. Now look at this. This kind of situations you can do by Elizarov, and sometimes we are doing also by open method. 5 years old boy, you can see syndactyly, you can do that. You can cut like this. This is the another do operation. You can do that, and from that situation to this situation, you can do this way also. This is macrodactyly. Look at this young lady, 18 years old lady. See the thumb. I took the help of the plastic surgeon with debulking this tissue here, and then I put the Ilizarov to minimize, to shorten the finger, mini Ilizarov apparatus, and then you can see from this situation to that situation. This is the after 3 months follow-up. This is distraction osteogenesis technique in the treatment of acquired and congenital shortening of the hand bones, again published in American Journal. Now, regarding understanding of the deformity correction, in every case, dear friends, where is the deformity or is the bone is deformed? Is it congenital or acquired? We must know the level of the deformity. We must know the plane of the deformity and angle, magnitude of the deformity, and where to do the osteotomy, what type of osteotomy you are going to do. You are correcting it accurately or you will go for gradual correction, and which kind of fixation you are doing internally or externally. With the Elizarov surgeon, we love to do the Elizarov cases with the Elizarov fixator and never operate on the wrong bone. So these are the 10 understandings of the deformity correction in case of upper limb and in case of lower limb. And in my conclusion, dear friends, In cosmesis and deformity correction, excellence is achieved by correcting the correct deformity at the correct coda based on correct planning by the correct method to achieve the correct correction. So this is very important for deformity correction surgeons. And I am happy that since today I have 91 international articles published and 7 books till today. And within a short time, I am going to finish my upper limb book by Ilizarov technique. And why I'm showing this? Whatever I'm showing this, dear friends, always this is based on evidence, based on science, and surgical skill of the surgeon. And we are doing that in my country. And Ilizarov technique has gained a very strong foothold in Bangladesh and in world arena. And I love to show this one. See, my mentor, Professor Shipso, Professor Elizarov, and my also good friend, mentor also, Novikov. I love to show this one because I learned a lot of things from my mistakes and from my old friends. And what on these today and in my conclusion, I love to show you, I love to tell you again, limb lengthening, any kind of bone and joint contractures, any kind of soft tissue contractures, bone loss, and delayed malunion, non-union, of course, any kind of infection and ischemic limb disease. And at the same time, if you want to widen your bone, you can go for destruction of the transverse destruction for widening of the bone. These are the things that what Elizarov learned us, what we learned from this technique. This is a very wonderful and fantastic technique by which you can correct any kind of deformity in your body. Thank you so much for your kind attention.
под этот формат и, может быть, из них получится какой-то обучающий курс там, по синтезу там, пальца, там еще что-то по синтезу человекостного сустава. И сейчас в свое время иллюстрировалось как монографии, значит, по хондропатии, там, множество вот эту монографию.
Sir, can you hear me, sir?
Сотни
Yeah.
Only just now.
Sir, yes, sir. Sir, yes, sir.
It was okay, clear?
Yes, sir. It was clear and it was a magnificent presentation. We learned many things from your presentation. Sir, I have one question. That is, do you face any nerve injury regarding the correction of deformity by Elizarov
In the hand,
in hand?
sometimes it happens. Sometimes it happens as soon as you see that you are touching the knob, you just remove that one, that wire, and nothing else.
Коллеги, вас слышат?
Now, I would like to request Professor Novikov sir to share his knowledge or ask any question to Professor Bari sir.
I haven't questions for Dr. Bari, and I am happy today because I saw so many excellent, beautiful, great result. And very good point. In last picture, Dr. Bari print. You can do it. With which methods we can help patients with severe congenital problem, with severe post-trauma case. Elizarov methods give us possibilities. Slowly go away from any problem, but only one. Dr. Bari, you show beautiful, but little bit, how I can say, this is not dangerous. We can see picture, but way young doctor need start with doctor like Dr. Bari. And upper limb, this is very difficult area for Elizarov methods. And if doctor ready for way, And treatment, how many months? 7, 10, 11, and doctor ready to be near with patients. Yeah, our methods can help these patients. If doctor think about only surgery, we cannot help because after surgery we cannot live. And Dr. Barry, how often you use shunt screw in the forearm? Because just now in the internet, so many doctors from South America, from Europe, use Elizarov frame with shunts. Did
Yes.
you, in
No.
your experience, what is better?
See, uh, I am a follower. I am a student of School of Ilizarov, and my centers and my visiting cards, everywhere is written School of Ilizarov. Once the fundamental principle of Ilizarov methodology is load and motion. Wires gives flexibility. When you are combined with pins and shunts, it gives rigidity, not flexibility. And in very little cases, in the upper end of the humerus, only
Yeah, I have,
depending on the
I have
case,
question. In
I use shunts. Nowhere
proximal humerus,
I
only
never
proximal
use
humerus.
shunts on the proximal and the humerus. Otherwise,
Me too.
even then, depending on the case, I also use wires in the humerus also. But in the proximal humerus, better to, if you have one or two shunts, you can put. And upper one third, middle, lower, radius ulna, and hand. Never I use shunts. I use always wires.
Thank you. Same technique, same principle, same. Thank you.
Thank you very much, sir. Dr. Shamsuludda, sir, do you have any
Yeah.
question?
Yes, I have a question with Bari sir. The same question I'm going to repeat with Bari sir. Sir, in one or two cases of non-union humerus with deformity or schizoarthritis, where there is hard sclerosis and a very long area that you cannot reject. So, do you in that cases just do compression and detraction or destruction, or you also do bone grafting also, sir? This hard
In
sclerosis.
case in case of sclerosis or atrophic,
Yes, sir.
okay, you
Yes,
that
sir.
just open, you just, if you need, you just open that one atrophic case, little bit you open, you clean up that, you could put a small guide wire to maintain the axis, and then you apply the Ilizarov. And whenever you are giving compression, even in sclerotic bone, when you are giving compression by Ilizarov technique, you are getting billions of cells around the line of compression. And when you are giving destruction, again you are getting slave. This is the beauty of, that's why the Ilizarov apparatus is called compression destruction apparatus. The Russians, they always tell not external fixated. This is a compression destruction apparatus. At the same time, you can go for compression and you can do the lengthening, that's destruction. Am
This
I
is
correct,
effect
bro?
of Elizara.
Yes,
Yes,
exactly.
this is the
Sir,
effect of
just
Ilizarov.
just to add, sir, even after 2 months, if you don't see any regenerate in after compression in humerus, so what do you do? You just then again do
Yeah,
distraction or apply graft?
I'll see. Elizarov, I have never applied any kind of graft in my life. This is the
Right,
violation of the rule of the Elizarov. If I sincerely
right,
follow the Elizarov rule, you can do
right,
that.
right.
Somebody is doing. But this is when with Elizarov, we are lengthening. We are getting regenerate bone. Why I'll go for bone grafting? If you are in doubt that you are not getting any regenerate bone, you please a little bit open up, or you put 3 or 5 cc autologous blood in that area, PRP,
Right.
autologous blood, and go for accordion method compression, 7 to 10 days, and then go for distraction. This
Distraction.
is the accordion method. Autologous
Thank
blood, see, you will get a very good result. But you should have to apply the apparatus properly. The striving force around the ring must be equal. You must check your weights so that proper tension is applied in the apparatus. These are the basic things. And for my, I'm telling you, my junior, a lot of cases that I am getting in my center. Now young surgeons, they're hardly putting the wires. This. Don't give any direction to the patient. Before applying that, you have a very good team, helping hand, and you must tell the patient, this is just like an aeroplane. Aeroplane. What that sentence I learned from Shirso. First day he told me, Marie, this is just like aeroplane. Remember, when aeroplane crashes, 400 or 500 people dies. Same thing with Ilizarov apparatus. If your stability is fantastic, check every day. Wires tension is okay, patient will not feel any pain. If tension is not proper, patient will tell you, doctor, we are getting pain, and patient will give you, all the time, doctor, what you remove this one. So that's why proper tensioning, proper application, these are the basic things after the application of the Elizarov.
Thank you,
And
sir.
if
I
you
have
do
another
that,
question, sir. Yes, sir.
yes.
So my second question in after severe burn contracture, suppose in a elbow joint in upper limb, you just do distraction or extension with Ilizarov, or you also add soft tissue procedures like tendon lengthening or grafters.
See,
Elbow contracture, sir.
I'm talking about the elbow. At this moment, I have two patients, one in my center, one in my diabetic hospital. See, you put two rings here in the distal part, proximal two rings, and apply hinges over the center of rotation of the elbow. Two hinge, two hinge, one medial, one lateral, and one you can put top up. Go for gradual distraction for 10 days. Then remove, do the exercises. Again, you put the hinges, do the exercises. When you're getting 180 degree, then you can remove. After 10 days, every time you just unlock the hinges, do the exercises. Again, you lock the hinge. Again, you go for distraction. 10 days, 10 days, you'll get a very good, outcome. Soft tissue lengthening is a combination of a stretch and regeneration. This is the theory of Elizarov. Soft tissue lengthening is a combination of a stretch and regeneration. Combination of a stretch and regeneration. This is the theory of again Elizarov.
Right, sir. So in very severe, even in severe cases, we don't need any soft tissue procedure or release. With Ilizarov, we can do everything, sir. Right, sir.
Yeah, yes.
Thank you,
Sometimes
sir.
I tell you, in case of knee contraction in AMC, remember, in AMC bone quality is not good. I do remove a resection of the bone from the lower femur or upper femur, subtrochanteric. Take the result, and then you put the guide wire, put the Ilizarov, and you can correct the contraction with pterygium in case of knee with AMC. You understand me?
Yes, sir. Right, sir. Right, sir. Thank you, sir. Thanks, sir.
Thank you, sir. Thank you very much. Thank you, everybody, for sharing your knowledge. And definitely, we will improve our knowledge by gathering knowledge. And dear viewers, it's a great day for us as because of we have learned many things from our honorable professor, Professor Mafakarul Bari sir, and we have a new guest in our Orthopedic Solution Academy from Kurgan, and I would like to welcome our new guest, and he will be the speaker in the coming Friday, and we will announce that in our e-poster, and hope you will come to know his name and the topic of presentation in the coming Friday. And till then, I am Dr. Mohammed Tanvir Ashraf. Want to say bye-bye. And before that, I would like to thank Raj TV for helping us to arrange this type of program, and definitely Renata Pharmaceuticals Limited for sponsoring our program. And I'm
Thank
Dr.
you.
Mohammed Tanvir Ashraf saying bye-bye to all of you. Bye-bye.
Thank you. Bye bye.